Hi ladies, I'm Dr. Katrina and I'm a chiropractor, and I wanted to take a second to go over with you the Webster Technique for pregnancy. Many of you may have heard of some of the benefits of seeing a chiropractor during pregnancy, such as reduced low back and pelvic pain, treating issues such as pubic symphysis pain, shorter labor and delivery, or a more natural birth that requires less intervention. The Webster Technique is a specific chiropractic analysis and adjustment that you have to get specific training in, and it involves looking first at the position of the actual sacrum. Now the sacrum is right here in the back of your pelvis, and it's right in between your two iliac crests, so those bones that are your hips, and together they form the sacroiliac joint. Your SI joint, you have one on both sides. So the actual assessment looks at the position of the sacrum. We do simple tests such as bringing your heel to your buttocks. We do that so we can check the resistance in some of the musculature or in some of the ligaments that go from the bony pelvis to ligaments and other structures, including the uterus. So we do a specific assessment to discover which side of the sacrum may be subluxated or misaligned. The reason that that is so important is for three reasons. The main thing is that it decreases the causes of dystocia. Dystocia is a long or difficult labor, and the first one is the passageway. So if you look at the pelvis here, you can see the opening of the maternal, the bony pelvis, and this is where a baby's head's going to be birthed and the rest of the body. So when the sacrum, again looking at it from the back, is subluxated, the actual opening in the pelvis is reduced in size. So that can be one of the issues in delivering. So one of them is the size of the passageway. We want to optimize that for the most room possible. The second is power. So it's looking at the power of the nervous system. As chiropractors, we correct spinal subluxations so that the nerves in this area can not only supply the low back and the pelvic muscles optimally, but also the nerves that actually supply the uterus. The uterus is a muscular organ, and during childbirth, during that second stage of labor, it's essential that the uterus contracts and pushes the infant through the pelvis. So we want good size of the pelvis, but also good nervous system supply to the uterus itself. The third P is passenger. So in this case, that's your baby. So your baby ideally will get in the best position possible for delivery, such as head down. Many people come to see us for Webster Technique if they've been told they're in breech position or the baby's just not in optimal position, so it could be butt down or otherwise. Now, the reason why adjusting the sacrum affects the position of baby is because it reduces something called inter-utero constraint. So imagine your baby inside the uterus, it's like it's wearing a tight blanket or a tight sheet. If we can do adjustments on the pelvis, it loosens that, and we're able to improve the mobility of your baby so the baby can assume a more optimal position. If the sacrum's out of alignment, it's usually too tight and the pelvis is restricting some of the movement of the baby. So some of the other ligaments we look for are ones such as the sacrotuberous ligament. So it goes from the sacrum to your ischial tuberosity in your pelvis. It's one of those bones that you actually sit on. So that's one ligament that we might release. There's also in the front of the belly, you can't see it here, but it's the round ligament. So the round ligament crosses as well from the uterus to other structures that attach to the pelvis. So while we're not physically getting in there and trying to turn the baby, we're not doing an ECV, we're not actually putting the hands directly on the abdomen, by influencing the position of the pelvis, we can cause those ligaments and muscles to relax, allowing baby to get a more optimal position for delivery. What often happens is when one hip bone or iliac crest rocks forward, that same sacrum might rock back. So we want to restore that balance, especially if when you're coming in, you already have some sort of translation, perhaps a scoliosis or a misalignment in the low back. That is something that as chiropractors, we can take into consideration as well. Now, I did mention inter-utero constraint, so people do come to see us in breech position, but the Webster Technique is also something that can help a lot with pubic symphysis pain. That's that area right here in the front at your pubic bone. So a lot of women may experience pain there, into the groin or down the leg. You have a muscle here called your psoas. It's a muscle that crosses right here in the front. It can get very tight during pregnancy because of this increased lumbar lordosis. There's a lot of pressure on the low back, but we also tend to get more flexed and tight hips. So we'll look at the tight hip flexor as well. I mentioned the sacrotuberous ligament here. We also have the piriformis muscle. So that's a muscle that's deep into your buttocks. The sciatic nerve actually comes from the low back, travels underneath that muscle and goes down the leg. So you might actually experience numbing and tingling or pain down into the leg or in the buttocks. That's often during the 3rd trimester. So chiropractors, we may see you when you're experiencing pain in the low back, pelvis, or down the leg. Most commonly it could be in the 3rd trimester, but we really do encourage preventative or maintenance care. So we like to see mom, even when you're planning to conceive, but also throughout the pregnancy. A lot of women will see us 2 to 3 times a week to start if there's a particular issue, but we do really encourage mom to come in even once a week just in preparation for labor or delivery. So at our clinic, our chiropractors are trained in the Webster Technique. You can look up more about it. If you have any questions, please do let us know, but I hope that helps to provide some guidance on how we can best help you. All right, thank you.